So today we're going to do a shockwave treatment for a patient with rotator cuff tendinosis. So tendinosis basically just means that they've had a long-standing injury to the rotator cuff and the tendon is no longer inflamed and it's actually degrading a little bit, and that can be quite painful. And in even longer-term injury with tendinosis, he's at a risk for having a tear into the tendon. So he's tried various forms of rehab to help with the shoulder, with some success, but we want to try using shockwave therapy to help use the sound waves penetrate down deep into that area where he's having a tendinosis in the rotator cuff to stimulate a healing response, and then that tissue can rebound and recover at a higher capacity. All right, so we're going to start here. We're going to be working all the shoulder joint all around that rotator cuff as best we can. All right, you ready? Mm-hmm.
So to treat the shoulder, we're going to address the front part of the shoulder first, and we're going to use the shockwave machine up and down the front part of the joint, and the sound waves will disperse and penetrate deeply throughout the entire front part of the shoulder, and it's going to go through the rotator cuff tendons, and as it does that, it's going to cause a mechanical irritation to those tissues, which then your body is going to perceive as an injury. And in doing so, that will then create a healing response in the area. Your body's going to send growth factors there. It's going to increase capillary production to increase in blood flow, and that will help with the healing process. So as we continue to do the shockwave treatment into the area, you'll start to see some redness develop, and that's bringing in some blood flow to the superficial muscles, can help with trigger points and some myofascial pain that might be in the area as well. So we're also going to get into the side of the shoulder and the top part of the side shoulder joint where the supraspinatus tendon inserts into the upper arm. This will help a lot with supraspinatus tendinosis, which the patient is suffering from. Now we're going to work the back side of the shoulder blade where the infraspinatus, teres minor, and supraspinatus rotator cuff muscles lie. And we're going to address not only the muscle bellies, but we're also going to follow the shockwave machine into the posterior capsule of the shoulder where the rotator cuff tendons lie. And so we want to work the back side of the joint as best we can so those sound waves can, again, cause some beneficial irritation into those tendons, and the body will begin a healing response into those tissues so they can regenerate fully. And for the final part, we're going to have the patient put his hand into his lower back, and this will help open up the top part of the shoulder where we can have really good access to the supraspinatus tendon. So we're going to use the shockwave machine up and down the upper trapezius muscle, and those sound waves are going to penetrate deeply all the way to the supraspinatus muscle belly, as well as the supraspinatus tendon and top part of the shoulder joint. So this is our patient's fourth and final treatment using shockwave therapy. After the fourth treatment, we go into a wait period of about 4 to 6 weeks. The accumulation of the 4 shockwave treatments continues to have effects at the cellular level for additional 4 to 6 weeks, so that's why we wait, and then we will reassess to see if the patient needs further treatment using shockwave at that point. But the patient should continue to see improvement in terms of pain and dysfunction in his shoulder during that 4 to 6 week wait period.
Your arm. And just move it around a little bit and see how it feels after doing that.
Yeah, it feels good. It feels loose.
Feels loose? Mm-hmm. All right.